So I am Heather Fellner. I'm a physical therapist. I've done a few videos going over some exercises in general, and I had a surgery on my right knee on October 26th. The surgery itself is called an osteochondral allograft, which is a fancy way of saying that they took some donor cartilage and replaced a piece of torn cartilage in my knee with somebody else's. I have been non-weight bearing, and then 10% weight bearing, and then 25% weight bearing since then. On Tuesday, 2 days ago, I saw my doctor, and he finally has cleared me to start increasing weight bearing as tolerated, with the hope that I should be able to get back to work in 10 days. Because it's been 2.5 months without putting any real weight on my leg, I have lost a lot of muscle mass. You can see even the size difference between my left leg and right leg. In my thighs as well, a lot of the muscle has deteriorated because I haven't been using it. I've been doing my exercises for the acute phase, which are things like long arc quad and my knee flexion. I've been doing some standing exercises for my hips and for my quad itself and for my hamstrings. But as I've told many a patient, honestly, the best thing you can do to maintain your strength or regain some strength is walking. And unfortunately, because I've been partial weight bearing, I haven't been able to really put enough weight on my right leg to keep the strength in it. And I've lost quite a large amount of strength, a lot of muscle mass, and I need to be able to return to work. So in that vein, my goal is to go over a few exercises now that I'm out of my acute phase. I am still in a healing phase, so I can't do anything really drastic. Eventually I can do some squats, but I shouldn't be adding any weight to it, any extra resistance. Everything I'm going to be doing is body weight. I am still using one crutch right now. I'm probably between 50 and 90% of my body weight on my leg, depending on how far I'm walking. It gets a little bit tired. Stairs, I pretty much am close to 50. But I'm working on increasing that. So what I'm going to be doing today is going to be more sitting, and I've got a TRX that I'm going to use as well. I want to work on my hamstrings. I want to work on my quads, the muscles in my hip, and I really am going to focus on the right leg. I am going to be doing the left leg as well a little bit after my video, just to make sure that I'm maintaining equal strength. I also have some chronic back problems, and because I've been spending the last 2.5 months sitting in a recliner or other chairs or laying down and haven't really walked a lot, I also want to add in some core exercises, because as I'm starting to walk more and walk further, my back is starting to make itself known again. So I really need to make sure that I'm keeping up on that part as well. So I'm going to show a few exercises that I'm going to do, and I'll talk about which muscle groups I'm focusing on during those exercises. Like I said, I am going to use the TRX for a couple of these exercises because it really adds a nice aspect of balance to everything, and it makes things a little bit more difficult. I'm going to be using my physio ball for several of them as well, again, for the balance component as well as just the difficulty. So the first exercises I'm going to do is I'm going to be just going through the same exercises I was doing in an acute phase, except in the acute phase, when I was doing them sitting in a regular chair, now I'm going to be doing them with a physio ball. So this isn't weighted or anything, so all of the stability in the ball comes from me making sure that my foot is planted, my weight is centered, and everything like that. So it becomes a kind of core exercise in that I need to make sure that my core stays nice and strong during these movements to keep myself from wobbling all around. Okay, so the first exercise is going to focus on my hip flexors. We do have one of our quadricep muscles that crosses the hip, so to an extent this will be targeted as well, but there's another exercise that I'm going to be doing later that's going to be a little bit more focused on that. So this one is just marching in place. So as I said, the main focus is going to be on my hip flexors. Just raise my leg up and down. When I'm doing this, one thing I want to avoid is letting my ball move, letting my back move, anything like that. I want it just my leg coming up. I want all of the movement at my hip. And as you can see, there is a little bit of balance. I am still moving a little bit side to side, which is, you know, it's been a while since I've used it. So it's somewhat normal. I do want to try and focus on improving that balance a little bit and becoming more and more stationary as I go. Again, that's an exercise I was doing in the acute phase as well to work on those hip flexor muscles. Generally, you want to keep everything above and below the joint in question strong in order to better stabilize it and support it during its healing. So below we have my dorsiflexors. My tibialis anterior is our primary. So this one, all I'm doing is lifting my toes up and down. This is a really simple exercise, but I have lost some muscle mass in this muscle because this is the muscle that is primarily used when we're walking to lift our toes up so that our foot clears the floor without dragging. So again, walking less means I haven't used this muscle as much. So when I do these exercises, this one I usually will do both feet at the same time because it is fairly simple. Sometimes I will hold that contraction in that muscle for a count of 5 before bringing it down, just to give a little bit extra endurance and static strengthening versus the more concentric. Again, it's, you know, either way, it's still a very easy exercise. Same thing now, heels are going up. This is working on my calf muscles. So we have our soleus and our gastroc back there. Those are our prime movers for this one. So all I'm doing is lifting my heels up in the air and back down. I do want to look at my ankles. I don't want them to kind of go out like this. That's allowing me to basically lose stability in my ankle. So if I'm getting any movement in the ankle going around or out, that means I'm not using the muscles on the inside and outside of my leg to help stabilize that ankle. And that can lead to problems in the ankle in the future. So that's just something that, generally speaking, I want to make sure that I'm always engaging those muscles throughout and try and keep stable. And you can always add a little bit of cat resistance if you have one handy. This is Sansa. She was sleeping on the bed all morning and all afternoon, and apparently has now decided that she's going to wake up and be very needy. All right, so the last exercise I'm going to do in this position is going to be for my quadriceps themselves. So the quadriceps are 4 different muscles on the top of our thigh. These are the ones that are responsible for straightening our knee. So the exercise is going to be kicking my knee straight. With this one, I try and hold it for 3 seconds if I can, because I really want to get a good contraction in that muscle. That muscle is the one that's primarily responsible for slowing me down when I'm going down the stairs, the power for going upstairs. It's used to an extent when you're walking. Really, honestly, a lot of the muscle use is very minimal. Ideally, if I'm well balanced in my gait, I'm going to be just kind of background activation of those muscles. But this one, like I said, for things like being able to do the stairs and uneven ground, this is a really important muscle. So I do want to make sure that I'm getting this one strong. Again, you know, I want to make sure that I'm balancing well throughout the movement, try and keep my torso nice and tall and straight, pulling my belly button towards my spine in order to activate my core muscles to keep myself stable. Good. So that's it for them sitting. I was previously doing a hamstring curl sitting, I was mainly doing that to focus on increasing the flexion, which is the amount of bend in my knee. The two most important exercises for really any acute knee surgery, because we lose a lot of range of motion because of all the swelling and the pain, is really our range of motion exercises. So we want to regain as much flexion and extension as possible. Obviously, you double check with your surgeon. So my surgeon, in the very beginning after surgery, I was wearing a locked knee brace. So that brace, when I was up and moving and really, anytime that I wasn't actively doing my exercises, I would keep it locked at 0 degrees, which means that my knee was straight. This was to give my knee a little bit more support during that first 2 weeks after surgery to recover and heal. The knee brace itself was locked to 90 degrees of flexion. So when I was doing my exercises, I wasn't doing more than 90 degrees for my flexion. That was also the surgeon's protocol. Sometimes you will have a surgeon that says, we're going to keep it at 90, but when you're doing your exercises under supervision, you can take it off and go more than 90. But most of the time, if you have a brace like that, they'll lock it at the position that they want you to max out at. After 2 weeks, I was cleared for increasing the flexion, and he said I could take the brace off if I needed, unless I needed it for the extra support. So I weaned myself off the brace, and I was still partial weight bearing. So once I was off the brace, I really focused on increasing my bend because I wanted to be able to have my full flexion back in my knee. And I did also work on the extension. Again, I want my knee as straight as possible. Ideally, my knee should be at 0 degrees of extension. So that is the amount that I want to be able to walk normally. Keeps me from limping. Also gives you more support when you're walking. And as I said, ideally, if my gait is normal, a normal pattern of gait requires very little muscular activation. So if I'm walking with my knee straight, my quads don't have to work as hard as they do if my knee is bent. So that's one of the reasons why I usually will stress on getting the extension as much as possible first. And because I was locked at 0, I had about 5 degrees, so no brace is perfect. It's gonna be a little bit loose no matter how tight you make it. So while I was able to do 0 degrees, I was probably somewhere around 5 or 10 degrees. And so once my follow-ups came, and I made sure that I kept increasing it and kept myself, I think I'm at 0. I haven't measured. My surgeon did, but I forgot to ask him how much because I had too many other questions. So I'm gonna turn. I know. So my flexion exercises, what I did was basically bending, and I usually would slide my foot. So I'd lift my foot up just slightly so there wasn't too much drag, and just bend it as much as I could. Once I got a good stretch, I would hold it for a count of 5 and then let it back out. Now I can bend up to about here. I still need to be able to get a little bit more. I used to be able to sit on my heels, so I'm not there yet, but I'm still working on it. I can't get enough bend in this position, even with a open chair instead of a ball, so I'm not really going to worry about working on that today. The extension that I was working on before, during the acute phase, was just like this. So what I did was pushed my knee as straight as it would go, really squeezing with my quad muscles, and I would hold that contraction for 5 seconds and then relax. And I don't bother to bend or anything like that unless it starts to get too sore. I usually did it for about 5 or 10 minutes at a time. I have a recliner upstairs, and so what I would do is roll up a towel and put a towel underneath my ankles to lift it up a little bit, to give me a little bit more room so that my knee was completely unsupported. Trying to get as much of my leg off the chair as possible. That gives you the most stretch, because otherwise you hit the couch or the cushions and you feel like you're straight and you're still very far from straight, and then you're also pushing into the cushions instead, which it just gives you resistance that you don't really need. So that's how I was doing my stretches previously. Like I said, my Range of motion is pretty good right now. Still working on it, but it's not necessarily as vital to me in this point in time as getting my hamstrings and everything else a little bit stronger. So I'm going to move on to some hamstring exercises, which means that Sansa has to leave me. So I'm going to start by using the physio ball for this one. And then I will do them a similar exercise, possibly the same ones, depending on how strong my hamstrings are, with the TRX, with the straps here. So what I'm going to do first is I'm going to work on my hamstrings with my knees straight. This is going to be the easiest position for my hamstrings, which means that I'm going to kind of gauge how much strength I have, make sure there's not pain in the knee. It's a little uncomfortable. And again, you know, I've got a lot of weakness there, so I'm really trying to focus on actively contracting, making sure my weight is equal between my left and my right foot. One way I can tell is whether or not the ball moves. And I'm just pushing up and down. So I'm squeezing with my butt cheeks, I'm squeezing with my hamstrings, and I'm just bringing my leg up and back down. The next position, which is harder, is doing it with my knees bent. This one is more glutes, whereas the other one was more hamstrings. When balance becomes an issue, putting your hands down by your sides makes it a little bit easier to balance. You can do your elbows, makes it a little harder. Arms up is your hardest. And that's where I kind of lose my balance. Also, when I'm doing these, my feet are together. I can put my heels a little bit further apart. That gives me a little bit more of a stable surface by having a wider base. So that makes it a little bit easier. Again, a little bit weak, so I'm not going to do too many, especially in that position. So I can do the same thing with the TRX. It's a slightly different setup, slightly different use of the muscle. And I may be able to advance this one slightly depending how it goes. So I want my ankles inside the straps. I can do it with just my toes in, but again, since I'm a little bit weak today, I'm not going to push it. I'm going to start with just my ankles in there. So the first thing I want to do is I want to work on my glutes themselves. So I'm going to just do kind of a reverse plank. And find out how weak I am. Then I can come up and do the same position I was before with my shoulders down on the floor. Again, this is just kind of a reverse plank, similar to a bridge, except that I've got my knees straight so I get more hamstring. So I know my knee's not going to tolerate it. Today I'm not strong enough to do it, but the next step would be to do it with my knees bent and coming up and bringing my bottom up off the floor. Again, I know my body, and based on how it reacted to that, it's not going to be able to do that today. From there, on the ball as well as on the TRX, when I'm up, I could do a hamstring curl. So basically I'd pull up, curl towards my butt, come back till my knees are straight, and then bring my bottom down. Those are the more advanced maneuvers. And you want to kind of pace yourself depending on where you are. Right now, I don't have enough strength to be able to do that without risking irritating my knee. Everything is healing well, so it's not necessarily like it's going to damage anything. It's just irritation. I might end up having some swelling on it. make it a little bit too sore to be able to do any exercises tomorrow, and I don't want to risk that. I can also do a good old-fashioned bridge. So my bridge is on the floor. I'm going to bend my knees, lift my legs, or lift my bottom up. Now with this one, I can make it a little bit harder. I can do a single leg bridge. So with our bridge, we're working on muscles in our lower back, muscles in our glutes, and muscles in our hamstrings, in our legs that are our hamstrings. And which one, you know, how much of each it depends. So the more my knees are bent, the more likely I'm going to use glutes. The straighter my knee is, the more activation I'm getting in my hamstrings. The problem with having my foot too far out is I might get a Charlie horse, because that ends up, it's a lot of hamstrings. So it really gives you a very uncomfortable, crampy feeling. So you do want to make sure that if you're, you know, targeting your hamstrings, just be aware you might end up giving yourself a muscle spasm, a Charlie horse in the hamstring muscles back there. So just be careful. So, the hip exercise that's also a little bit of quads that I wanted to show is a basic straight leg raise. You can do this straight leg raise in 3 different muscle groups. So we can do it forward, sideways, and backward, well technically 4, to get our hip flexors, extensors, abductors, and then adductors. So I'm gonna just start with my hip abductors. So I like to have my bottom leg bent so that it gives me a little bit more support. My bottom leg is in line with my top leg, so my knees are actually touching, but I'm kind of have it bent to about a 90-degree angle. Now I'm gonna lift my top leg up. When I'm doing this, I want to make sure my toes stay facing forward. I don't want them to rotate up to the ceiling, because that's going to activate more of my hip flexor versus my hip abductor. So I want to come up. I'm not really worried about how high I'm coming, because once I get to here, I'm not really working on these muscles. I'm really just kind of moving my back more. There's only so much movement that comes from the hip. So doesn't really matter how high, as long as you're really activating these muscles on the side here. So this is our gluteus medius. It attaches into my IT band, which goes down just below my knee. The IT band isn't a muscle, it's a piece of connective tissue, so I'm not really strengthening my IT band. However, I am strengthening the hip muscle here. And this is one of those muscles that actually works pretty hard when we're walking. Helps to keep our pelvis stable and stationary when we're walking. If it gets too weak, we tend to lean onto our sides, or we drop our hip and you end up having this kind of model runway walk where your hips are swaying. That's if you do it on both sides. So with that one, we generally want to make sure that that stays strong, because again, haven't really been walking a whole lot, haven't had to use that muscle as much, been on crutches when I have walked. So that muscle, if it's too weak, and it is, I end up leaning too far to the left. And right now I still have a crutch. I find myself leaning to the left onto that crutch, and it's not just for the weight. So what I want to really focus on when I'm walking is I'm trying to stay very stationary, very vertical, and not allowing myself to lean too much, which means that I need that hip abductor to be nice and strong. So the next one I'm going to do is my hip flexor. This one is also a quad muscle. So because I'm keeping my knee straight, I'm getting some quads as well as my hip flexors. When I bring my toes up towards my head, that gives me a little extra contraction in my quads. So every time I come up, I'm going to squeeze my quads, pull my toes up towards my head, and then I'm going to lift my leg up. I only need to come up as far as my other knee. I don't need to come up any further because that ends up running the risk of putting a lot of strain on my lower back. The reason this knee is bent is to help keep the strain off my lower back. You can do it with your knee straight, but you might end up having more pulling in your back, and it just doesn't, it's not typically very comfortable for people. So usually this is the easier way to do it. Again, I want to keep my toes pointed straight up to the ceiling. I don't want to rotate them at all. I'm really looking to get that muscle straight in the front of my hip and thigh. So we did the hip abductors. We can do hip adductors. So this one, there's not a lot of movement in it. I'm basically working on my inner thigh muscles. I don't tend to do this version of a straight leg raise very often because you don't really get a whole lot out of it. Anything where you're squeezing your knees together with a little bit of resistance, you're going to get more out of it than that. So I don't usually focus too much on it. That's why I said there's 3. That is the 4th, but it's not one that I do very often. My top leg was bent at the knee so that my leg was in front of me, supporting my body in my position. And then my bottom leg was straight, toes pointed forward, and I was just lifting it up towards the ceiling. So last one that I'm going to be doing is going to be my hip extensors. Again, there's not a lot of extension in my hip. In most hips, you only have about 10-15 degrees, so you're not going to get a whole lot of movement. You are going to get some movement in your lower back, so you want to make sure that you're careful with that. If you start feeling any pain in your lower back, you don't want to lift it quite so high. So my knees stay straight-ish during this, and I'm just lifting up. So that's really it for the knee and hip exercises that I'm going to be doing today. I'm going to do a couple advanced versions of a plank. I'm going to be using my ball and my TRX, but those I have demonstrated in the past. There's not going to be anything different. So if you're interested in that, I have a video for some core exercises for planks. And I'm probably going to do some dead bugs as well, which I have another video for that. So again, this isn't, saying this is an exercise program that you can do just because you had knee surgery. You should be following the direction of both your surgeon and, if you have a physical therapist, your therapist. If you don't have a physical therapist, you can talk to your surgeon, ask him if he has any preference on what kind of exercises you do. He probably will tell you, why don't you go to a PT so you can get more structured therapy. I did not go to an outpatient physical therapy setting because right now COVID is going on, so it's a little bit more difficult to do. Also, because I'm a therapist and I have my own equipment down here, I didn't really see a whole lot of need. Since I'm going to be going back to work soon, my schedule is going to be a lot harder to accommodate that. And really, in the beginning stages, I was so acute, I couldn't really do much, that there wasn't really a lot that an outpatient therapy setting would have benefited me. Now that I'm past that acute phase and I'm able to move on to more difficult exercises, this would be the time that I would recommend most patients go to an outpatient therapy setting and get the more structured environment, getting some equipment, getting some correction to make sure you're doing things in a way that puts the most benefit to your knee without putting too much pressure on it. Really gives it a good structure. So that's just my little plug. Again, I'm allowed to put my full weight on my leg. However, I'm not really because it hurts. So I was going to do some squats. I forgot to mention that, or I had mentioned it and I forgot to do them. So what I'm going to do is shorten up my TRX here. And I'm going to use this to help give me a little bit of support. So that way I don't have to put as much weight on my legs. And I can still get a good squat. So I really am probably only doing about half of my body weight because I want to do multiple squats. I have done squats mainly when I've had to pick something up off the floor where my weight is a little bit more on my left leg than my right. You can see if you look closely how my weight is kind of shifted to the left. You can see my hips are more directed over my left leg than my right. So I just kind of tried to fix that a little bit. So that's one thing to look at when you're doing anything like a squat or anything where you want to try and keep your weight somewhat equal, is where your hips are in relation to your feet. So if my hips are over onto one side versus the other, I'm very likely to be putting more weight on the side that I'm shifted towards. And it's really not a conscious thing at this point because I haven't been able to put weight on that leg, or at least not a significant amount. So a lot of things that I've been doing, I've been trying to maintain as little weight as possible through that leg. So I have to be more conscious of it now that I'm allowed to. I have mirrors in front of me behind the camera that I'm able to kind of keep a good eye on to see how my weight is distributing between the two legs, making sure it's somewhat even, if not slightly more on the right. Again, I had quite a bit of weight through my arms to keep from putting too much weight in my legs. Allowed me to do that a few more times than I otherwise would. So that's it for the exercises, and I hope you enjoyed. Don't mind my lean.